I'd now like to welcome to the stage, please, the chair of GS1 UK and also non-executive director of DEFRA, Department of Food and Rural Affairs, Mr. Tyas OBE.
Good morning, everybody. And as Glenn said, a special welcome to you all, whether you come as delegates, speakers, or exhibitors to this, the 2025 GS1 UK Healthcare Conference. As the chair of GS1 UK, now over the last 6 years, I've attended 3 such conferences. And this is by far and away the best attended. It has the most comprehensive, relevant agenda, as well as the widest ranging exhibition that I've seen at any one of these conferences. And I would strongly urge you to spend some time going around those stands during the break. It'll take you several trips, I can tell you. The timing of this conference is significant, coming some 20 years after the journey to extend the technology and knowledge that's common in the world of food and retail, from which I come, to healthcare, to save millions of pounds and hundreds of lives. Along that journey, we've seen several significant steps. The NHS e-procurement strategy, barcode technology, and scan for safety, to name but a few. But equally, there's been some wonderful local innovation, local cases developed locally by hospitals and communities for the people that they serve. The bed occupancy at Leeds, the self-medication at Aberdeen, particularly for children. And I could go on with many other examples, because that's the spirit that's there. The last 2 years since our last conference has seen many, many steps forward. The National PIM, the National Implant Register, all of those are recognitions of the bits that we talked about last time at this venue, the importance of accurate, relevant master data used by all. The timing of this conference, by design, and yes, I probably have to admit a bit by accident, could not have been better. GS1 UK's strategy is perfectly aligned with the recommendations that we saw coming out of Baron Darzy's report, as well as the NHS strategic priorities. Whether it be from analogue to digital, from hospitals to communities, or from sickness to prevention, GS1 standards support all those goals. But this conference is, of course, also the first major event bringing so many professionals together since the announcements of the changes of NHS England. We hope to provide during these 2 days an opportunity for discussion of these changes and what they will bring, but with the knowledge that the goals of improving traceability, decision-making and reducing errors, accurate data capture and sharing, streamlining procurement and supply chains, most importantly, saving time, money, and ultimately lives, are the ultimate goals that we all share. Of course, I've talked about England, but especially in the last few years, the changes have become fully across the 4 nations. And that progress and the standards have been shared across some 75 other countries. Later in these 2 days, Renaud de Barbiat, the global CEO of GS1, will be here to share his thoughts and the implications of such wide-ranging shared standards. But what it does mean is that the ecosystem of partners, many of whom are with us here today, either in the exhibition or taking part in the proceedings, have an economy of scale across the world, and what we do is looked upon closely as the standard for many others across the developed and developing world. In GS1 UK, we're just commencing the second year of our new 3-year plan. That has at its core 3 things: resilient supply chains, and my goodness, isn't that relevant after the news of Spain and Portugal in the last couple of days. Empowering data-driven decision-making and supporting safe, efficient care. Looking ahead, there's still much more to do. Now, just before I finish, can I briefly take a few moments to give some thanks and acknowledgements? First of all, to our 3 principal sponsors, EY, Genesis, and Advise Inc. Secondly, to our many exhibitors who have brought examples of best practice, latest technology for us all to see and share. And I'd reiterate my request to all of you to go and spend some time and see that. It's an ideal opportunity to be able to see and compare all the offerings at the same time. And thirdly, our speakers who have given freely and generously of their time in preparing for today and being here. But lastly, and most importantly, you, our delegates, who have taken time out of your busy lives because you want to be a part of those developments within healthcare that are so important to all of our lives. We read every day of the challenges facing UK healthcare. Many, many of you in this room today confront this every day, every hour. Our country owes you all a huge debt of gratitude, to you and your colleagues who are not able to be with us today. But we also owe each other and to citizens the responsibility to collaborate and learn from each other, and especially to use the facilities that new technology brings. This is what the next 2 days is really, really about. As we look towards the challenges of tomorrow, I hope we can celebrate. We can build on the progress that we've made, and I've talked about some of those, particularly that we've had over the last 2 years. But most of all, that we can go forward together. I'm looking forward to the discussions, the networking, and particularly how we work together to shape and change the future of UK healthcare. Thank you very much indeed. I'll hand you back to Glenn. Thank you.